Chapter. Thanks so much for joining us this morning. We're really excited to have the speakers that we have this morning. I'm going to give just a few announcements and then we will get started. Again, thank you for joining us. This would have been our monthly educational luncheon in person at the Junior League, but I'm so glad, excuse me, so glad that we were able to offer this virtual feature. Please forgive us for any technical difficulties. We're still somewhat new to Zoom, so if you're having trouble seeing us, as Megan said, toggle within the different settings in Zoom and see what works for you. And you can also message Megan. She's logged in as AFP Houston staff, and she'll try to troubleshoot anything, any trouble that you're having. So I hope that you all are home safe and healthy as we're all adjusting to these new circumstances that we find ourselves in. And I continue to be amazed by the resilience of our community nonprofits. And I know that as fundraisers, we're going to come out stronger for this. So as we do at our monthly luncheons, I want to let you know about a few things we have coming up. As a chapter, we have been working hard to adjust to our current circumstances, like making events like this virtual. So please keep referencing our website. We're at afphouston.org for resources and upcoming events. For instance, we have 2 more Zoom sessions in the next couple of weeks. On April 29th, that's next Wednesday, we have the second of our hometown talks, as we're calling them, following last week's panel, if you were able to attend that. The April 29th topic is pivoting to best and next practices during and after COVID-19. It's going to be a 40-minute panel discussion with panelists comprised of Houston area consultants, and they'll be sharing their real-time experiences with organizations across all sectors, sharing best and next practices, lessons learned, and fundraising trends both locally and nationwide. And as with all of our virtual offerings right now, it is free to members, so head to our website to register. And then on May 8th, please plan on joining us for the topic Virtual Planned Giving in Partnership with Charitable Gift Planners. And more info on that is to come. Then it's much further down the road, but we would also like to announce that this year's National Philanthropy Day will be virtual as well. I know that that's going to be disappointing for many, but our fabulous event chair, Kate Yadon, and her co-chair, Fanny Brown, have some great ideas, and I know they're going to make it something to remember. We know that many of our members are struggling right now as well, so we want to make sure that you're aware that AFP Global has made payment plans available for membership renewals, and they're also offering $50 off of new memberships through the end of May. And then here locally, our chapter has scholarships available to assist with chapter dues. So we want to also encourage our members to fill out our COVID survey that was sent out to help us better support you and your organization at this time. So let us know if there are other things that we can be doing, resources we can be providing. We are here for you all. And that survey can be found in all of our e-blasts this month as well. And then if you've got anything that you want to share, things that have been working for you, we also invite members to write posts that we'll share on our and also send out in those e-blasts. So you can email Rachel Rodriguez. She's our VP of Communications, and her email is rbrodriguez@mdanderson.org, or you can also email info@afphouston.org if that's easier to remember. Okay, so now I am honored to introduce this morning's speakers. Alice Ferris, who has all kinds of credentials behind her name. You might recognize Alice from this year's virtual icon. And James Anderson are partners in Goalbusters, a consulting firm specializing in hands-on comprehensive fundraising leadership for small to medium-sized charitable organizations. Their team offers services in development and campaign assessment, strategic planning, campaign direction, board and team training, grant writing, and specialty services for public and community media. Alice and Jim are in the trenches with several organizations helping to inspire and facilitate growth and evolution in fundraising programs ranging in scope from $100,000 to $54 million. Alice and Jim are seasoned international speakers and AFP master trainers. So let's give them our full attention as they dive into the topic for this morning, 1,000 words using visual storytelling to engage your communities. Alice and Jim.
Thank you very much.
Thank you.
And actually, I'm going to share my screen, and you will see that we've kind of tweaked the presentation a little bit today in order to better address the situations that we're in right now. And we will address some of the storytelling, visual storytelling elements, I'm sure, when Jim talks about his section. But in general, we wanted to make sure that everything that we present during this time of, as we are sick of hearing unprecedented times, that we're giving things that are relevant to you in the situation that you're in now. So thank you very much to AFP Houston for allowing us to present today, and we will get started. So assuming you can see the screen, Jim, does it look okay?
Yes, it does.
Okay. All right. When we talk about storytelling in a crisis, there are so many different things coming at us. And normally, under normal, quote unquote, normal circumstances, there are a bazillion things coming at us already. We have social media, we have email, we have radio and podcasts, we have now the constant ping of instant messaging, whether it's on Slack or other platforms. And we also have television and all of the television equivalents like YouTube and the other video streaming services. I almost said screaming services, which is actually not so far off. But we have so many different media choices nowadays. And I want you to think about your own inputs right now. You're sheltering in place. How many different things do you get pummeled at you on a given day? And when you think about all of the different things that you have probably seen just in your email inbox that say, here's our response to COVID-19, you're probably saying, I don't ever want to see another thing. In fact, I'm guessing that within the next few weeks, we're going to start creating filters in our email so that anything that has COVID-19 in it is going to go into a special folder that we'll deal with later. So there's a whole bunch of stuff going on, a whole bunch of stuff coming at us. So how do you cut through all of that? How do you cut through the clutter? Now, when you think about cutting through the clutter, I'm not thinking about just doing something completely radical and doing something completely crazy so that you stand out because you are so different. That's not necessarily the way to cut through the clutter. But what I do want you to think about is how can my communications be more authentic and more genuine for my organization during this time when people are getting a lot of information. So some board members, some well-intentioned board members, and some senior leadership that I've talked to over the last few weeks have basically said, you know, maybe we should just stop. Maybe we should just stop talking. Just don't communicate at all. And that can be a really natural reaction to times of crisis. It's the, I'm feeling overwhelmed. And so you project that feeling of being overwhelmed to other people. And you think, I just want to cut off all communications with everybody because I'm sure they're feeling like me and they don't want to get any additional information. Well, I'm going to tell you right now that this is my latest soapbox. My latest soapbox is no, don't stop talking. Were you about to say something, Jim?
Just that I think there's a number of reasons, like anytime someone takes an action or doesn't take an action, there are going to be different reasons for different people. Everything Alice just said is completely valid. I think there's also, though, some individuals who don't want to send out a message because they're afraid they're going to get it wrong. They're afraid that they're going to be tone deaf or they're going to make a mistake, and it's easier to do nothing and be blamed for neglect. I think it's an old Mark Twain saying, it's better to stay silent and be thought stupid than to speak and prove it. So it is safer, and there is that element. So keep in mind, a lot of people are making these decisions for different reasons, and it might just not be that choice of overwhelming.
So when we think about those choices of not talking and the choice of talking, I want to really reiterate why you should be communicating now. There are many, many reasons why you should be communicating now. Number one is nature abhors a vacuum. So if you don't say something and you don't control your story, people will fill in the gaps. Or frankly, they'll turn to somebody else to get information. So this was in an article that was pushed out by the Harvard Business Review yesterday in their daily newsletter. And the person who was writing this article about nonprofit communications during this time of crisis said, you know, if you don't tell people what you're doing, people will make stuff up. And they may decide that, oh, well, I'm not hearing from them, so they must be going out of business. Or, oh, I'm not hearing from them, so they must be doing really badly. When in reality, you may be doing okay, or you may be doing things proactively to make sure that you're going to be able to survive in the long term. So if you don't share your story, other people will make up the story for you. The other point is your audience values transparency now more than ever. Because think about it, when things are totally out of control, you like to know that some things are in control. And so being able to see behind the curtain for your organization and communicate what you're doing in mitigation efforts is going to be really valuable to your audience. For example, Lowell Observatory, which is one of our clients and a part of the reason why I came to Flagstaff, Arizona in 1996, I was their development director for 4 years and now they're a client. But when they had to shut down their public education program on March 13th, Friday the 13th, they ended up sending out a communication to their inner circle for the most part, which was about, I think, between 100 and 200 people that they were communicating with via email. And they said, here are the conditions. There has not been a shelter-in-place order issued in Arizona, but we anticipate that it will be coming. And it actually took 2 more weeks before that shelter-in-place order came. We're shutting down the education program because we are in prime attendance season when it's spring break and people are coming during spring break to visit Lowell Observatory for educational programs. And we're going to have a lot of people in a small space. So we're making the right decision to try to flatten the curve and we're shutting down the public program. The audience really valued that.
Yeah, it was a tough decision to make as well. When they did the analysis of what they're losing $133,000 a month just in lost attendance. You know, the average person spends about $25 to $28 there. That's substantial.
So the fact that they communicated that and gave people a peek behind the curtain, they got incredibly positive feedback from that communication. And in fact, they had people proactively reaching out to them asking how they could help. So your audience will value that. So please communicate what's going on with your organization. And then the third point is people are home.
Yeah, it's obvious Alice is home. She showed us a picture of some weird popcorn ball she made.
Oh, funny. I had to explain to Jim that actually is the coronavirus.
Well, I asked, do you know what that is? Yeah, Jim. I get that a lot.
So even though there's a lot of information coming at people, people are actually looking at it now. I mean, they're home. What else are they going to do? So case in point, for one of the clients that we work with, I do a lot of direct communication with donors. There's a few donors that we've been reminding for several months that your monthly contribution, your credit card has expired. And we're not naggy about it. We basically send them a letter or an email once a month for a couple months. And then if they don't respond, we just stop the monthly donation and call it done. And I sent out an email to all of the people that have responded so far. And they've been getting communications for months. This month, I sent out an email communication that basically said, hey, you know, your expiration date, your credit card has expired and we're all working remotely. So I'm sending you this email instead of sending you a letter. If you could update your credit card number on our website on this particular form, we'd appreciate it. I've had 100% response at this point since this shelter in place started. So people are checking this stuff a lot more regularly than they may have before. When before they may have said, okay, how fast can I get through and delete everything? Now they're like, oh, well, you know, now I have a little time. So consider communicating now just because people are home. So with that as a preface, what we want to do is talk a little bit about why you should be communicating, period. And that is my latest soapbox. And this screen, if this is the only thing you take away from our webinar today, I want you to take this away, which is if your mission was important before COVID-19, then it's important now. And as Jim likes to say, don't say no for people.
And I think something else that we've seen at all of our clients, I think all of them have experienced the same thing, is, we had to do an analysis. Are our gifts fewer than they were last month? Yes. But what we found is that they're bigger, and substantially bigger in many cases. In one case, we sent out an email for a virtual fundraising program we're going to do. Somebody who'd never given more than about $1,000 a year. We asked people to provide a matching contribution. This person came through at a $5,000 level and has just enhanced their relationship with this organization. And the messaging, when you're messaging and when you're asking, I think a really key thing to share is giving them permission not to give. We do a lot of work with public radio stations, and when we are on the air, we were on the air when this one is based in Yuma, Arizona, but broadcast throughout the western half of Arizona. And Yuma had not shut down yet, but we see cities across the country that are shutting down. And then during this pledge drive, the mayor or the governor gives a directive that we need to shut down the city, basically, as so many places have. And we never expected to be asking for gifts during a global pandemic. This is a first for me, and and Alice as well. We've never done a pledge drive in a global pandemic. We had to make a choice. Okay, we better shut up. People are scared. We better just shut up and quit talking. But we thought about it and we're like, no, you know what? This is going to impact different people differently. So in our messaging, we would say, if you are someone who is currently financially impacted by this, or if you are someone who is uncertain about your financial future or the health of your family, please do not give. We will be here for you. We will provide the service. And when things settle down and you have the ability to support again, we hope that you still will. But if you can give, think about the impact that you have right now for the neighbors who can't. And that's one of the ways of messaging that we started getting much, much larger gifts and repeat gifts. People who had already given the amount they normally give each year gave again.
And I think the piece that's important to remember about this is there are so many organizations, such as perhaps arts organizations, I see you, where you're saying we're not an essential service. And I would argue that what are people doing as they're sheltering in place? If they're well and they're sheltering in place, they are hungry for arts organizations to bring them content. Because what do you do?
Probably a dance challenge online on TikTok.
But it's what do you do in times of challenge, in times of crisis? You're looking for something that can be personally fulfilling for you. You're looking for something that can be enriching for you. So I would argue that arts organizations are more important now than ever. And if you are an arts organization or an education organization or a social service agency, again, if you were important before all of this hit, you're still important. And the only organizations that become unimportant because of COVID-19 are the people who make themselves unimportant. So make sure that you remember that you have an impact on this community, and we're going to give you the tools to be able to talk about the impact that you make. So with that as a lengthy preface, we're going to talk about why you should tell stories, what the classic story structure is and some of the themes, how you tell your stories, and then we're going to go back to special tactics during times of crisis. So those are the things we'll cover for the rest of the webinar today. So part one is, why should you tell stories? Why tell stories at all? Well, stories are great because they will help you remember, they'll help you share information, and they can help encourage action. As Jim and I have liked to say, nobody has been moved to action because of a PowerPoint slide. So how can you tell stories? How can you even take data that you have and turn them into stories so that you can better help people remember you, share your story, and not only encourage their action, but encourage them to encourage others to take action? So with that in mind, we're going to dive into four things that stories do. And actually, you will see there's a pattern of fours in this presentation. This is the first four things that we will talk about. And this is what stories do overall. And we'll get into more detail in here in just a moment.
Well,
Stories help.
Patterns of four, Alice, that's lucky, isn't it? Fours are lucky, aren't they?
4 fours are lucky.
Okay.
Double fours are lucky. So stories communicate history. They communicate identity. They help people remember, and they communicate culture. So we're going to go into a little bit more specificity on these four things right now. So let's start with history. This gentleman is Dr. John Caskey III, and this is how he looked a little bit later in life. And he was the founder of North Country Healthcare in Flagstaff, Arizona. He was a really, really interesting man. I met him when I first was working at Flagstaff Medical Center. And the thing about Dr. Caskey is that he was always a very straight shooter. He was somebody who said, here's my story, and there's not going to be fluff. There's not going to be a whole lot of politics. And the thing I really loved about Dr. Caskey was his ability to, create a yarn, so to speak. And he once told me, as the founder of North Country, how he founded the healthcare clinic. Because you're thinking, how does a physician in Flagstaff, Arizona end up founding a community health center that has locations from border to border across the Route 66 corridor in northern Arizona? Well, he says, well, Alice, I founded this because of a woman who annoyed me. Like, okay, well, this must have a story behind it. And he says, yes, he was an emergency room physician, and a woman came in with her child who had an ear infection. And he treated the child, and he says, I expect you to follow up with this child's pediatrician. Yes, Dr. Caskey. The next week, the child is back in the emergency room. Now the other ear is infected. Dr. Caskey treats the child again and says, please follow up with this child's pediatrician. Yes, Dr. Caskey. 2 weeks later, child's back in the emergency room. Both ears are still infected. The child's screaming bloody murder. And in a fit of frustration, Dr. Caskey says to the mom, woman, I told you to take this child to a pediatrician. And with equal levels of exasperation, she responds, I would, Dr. Caskey, if I could find a single doctor that would take us, because I don't have insurance. And he said that was the first time that the need for primary care in Flagstaff for those that were uninsured or underinsured became a reality to him. And that night, he, quote unquote, commandeered some supplies from the closet and voluntold some of his colleagues to meet him in the parking lot of the county health department that Saturday. He said, look for my station wagon. And out of the back of his station wagon, he and his colleagues started delivering free health care to anyone who would come. Now, the county health department may have gotten a phone call saying, you do realize there are people in your parking lot delivering health care. And by conversations with Dr. Caskey, who could be a very convincing man, they allowed him to have a space, really a closet, in the community health department, in the county health department. And what ended up happening was that Dr. Caskey ended up creating North Country Healthcare, which ended up becoming this. And this was the picture after the Capitol campaign that Jim and I worked on of the first phase of this new facility that replaced a renovated roller rink that they used to operate the clinic out of, and now has had 2 additions to it. And it is this beautiful healthcare center on the east side of Flagstaff. And again, they have locations from border to border across the Route 66 corridor.
Yeah,
So,
they peaked at 11 facilities. I think a couple of the small satellites, they didn't see enough of a demand. So I think they're like 8 or 9 now.
yeah. So that's the history of North Country. But if he had just said, well, I founded it in this year and we're a 501c3, blah, 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 blah. I wouldn't have remembered any of that. The fact that he tied it to a story of a moment of frustration and a moment of reality made it a much more real story to me. So it made it easier to remember the history of this organization.
Well, so they share history and they establish identity. Think about it. You meet new people all the time. Well, not now, but you normally meet new people all the time, and you size them up, don't you? You size them up. You take a look at it. You try to decide who they are, what they're about, if they'll understand you, if who you are will resonate with them, or frankly, if you like them enough to give them the juicy stories, because you usually don't. Until you've known somebody for a while and you've created shared history with them, then you build enough trust to start telling them the more interesting, juicy stories. In fact, Alice and I have been working together now for going on 15 years. She still hasn't heard all my stories. Some of them could be deal breakers, I think. No, frequently it is. So I haven't told you this? Wow, that's interesting. But if you met me, I've been traveling. This is the longest period of time I've been home. And well, I'm not really home. I'm actually broadcasting from the Fortress of Solitude, which is what I've called my house since my kids moved out. Incidentally, that's my son, Justin. And it's always been the Fortress of Solitude because I travel these days, the last 5 years or so, I average 180 days a year. This is the longest I've been home uninterrupted since, I believe, 1996. And so I call it the Fortress of Solitude, but frankly, it looks a little more like this. Because I'm one of those guys who take the extra roll of toilet paper at the hotel. So if anybody needs a roll, if you really need one, let me know and I'll hook you up. But that is me. And if you met me in Flagstaff when I was home, back when the kids were home, you just knew me as Mr. Mom. I was the Cub Scout den leader. I was the president of the PTA, a volunteer for the kids' hockey teams and with the Girl Scout team. My daughter was an honorary Cub Scout, my son an honorary Girl Scout, because I didn't go anywhere without my kids when I was home, because I was on the road so much, I invested everything in them. So those are the stories that you heard. But if you met me on the road when I was doing my job, you heard different stories. Yeah, that my mom calls that my James Bond photo. But you heard very different stories. I didn't tell you a ton about my kids unless I really got to know you and like you. I don't share a lot of truly personal stuff. If you follow me on social media, it looks like I share everything, but I don't. I'm selective about what I share, and I definitely have a private side that nobody sees. But you share different stories depending upon the person that you're talking with. So the stories help you share that history. They help you establish your identity, and they help you reinforce memory.
So the interesting thing about memory is that it's not necessarily about how stories help other people remember your story. In many respects, your stories end up triggering somebody else's memory that you may not even know about. And the best example we have of this is a recent one with one of our clients, Lowell Observatory, where they were talking to a potential major donor. In fact, it was the potential naming gift for their capital campaign. And they were talking to the trustees of this family trust and talking about the wonder of the night sky and talking about how the night sky inspires awe. And they talked about a story about a young person who had visited Lowell Observatory, who became so enamored with the night sky that he became completely obsessed with Clyde Tombaugh, who discovered Pluto, which in Flagstaff, Arizona is still a full-fledged planet. Thank you very much. But he was talking about this young man, the director of Lowell Observatory, Jeff Hall, was talking about this young man who had written in, his mom wrote in saying how obsessed this child became with Clyde Tombaugh, who he dressed up as Clyde Tombaugh for Halloween. He did his science paper on Clyde Tombaugh and all of these things. That's not what this donor remembered. That's not what this donor was thinking about. What this donor ended up triggering was a memory of his own. And he remembered when his grandfather took him out into what was then the dark skies of North Phoenix, which are not so dark anymore. But back then, there wasn't a whole lot out there. And he took his grandson out with a telescope and showed him the planets for the first time through a telescope. And this trustee remembered very, very clearly how wonderful that experience was. And by talking about the night sky and by talking about this young person who was excited about the night sky, this trustee immediately was transported back to being probably a 10-year-old boy and having this quality time with his grandfather. And because of that memory, because of that trigger, he didn't go around and share the story of Lowell Observatory. No, he remembered his own story. And that ended up triggering the naming gift for this facility, which is actually still on track to open in 2023, which is now going to be named the Kemper and Ethel Marley Foundation Astronomy Discovery Center at Lowell Observatory. So it's because a memory of his was triggered that he was able to be inspired to be part of this story and essentially create memories for other people. So stories can help not only help your donor or your person you're communicating with remember your story, but it also helps them remember their own. So then the last thing of this first four that we're going to talk about is communicating culture.
Okay, check that out. I'm sure you recognize this. I'm not looking at the chat or the questions, but I would ask, do you know what you're looking at? For many of us, we will think, oh, those are Western movies. You know, I remember the old John Wayne movies. That's where John Ford shot all of his stuff, right? But if you're from Asia, they'll say, hey, it's a cowboy in a red shirt on a horse in the desert with a white hat. It's a Marlboro commercial, right? So your relationship and your experience helps identify how you view a culture and whether you feel as though you're a part of it or not. Think about where we are right now. Think about where we are, because everybody has a single shared culture right now. Almost everyone in the world is going through something that's related to COVID, that has had their life disrupted because of COVID. You may be telling the story to your great-grandchildren of what it was like to experience this, because this is a culture shift for us. We all share some cultures, but there are others we don't. You know, we could say, well, what's something that we share? Okay, I think we're mostly AFP members. We live in the United States. I think everybody's living there. We're on the beautiful blue planet Earth, floating around in the Milky Way. So we share all of those things. There's some things we don't share. Look at Alice and I. There's a whole lot of culture the two of us don't share. But if you think about those things, think about what culture you've established. Okay, what culture have you established at your organization? What do your stories say about your culture? We've all been in a restaurant, not recently. We've all been in a restaurant or a retail business or something, and we walk in and immediately we're like, oh my God, these people hate each other in here. We've had that experience. And think about your own organization. Maybe people don't hate each other in your organization, but you got silos. Are there different people that do different things and aren't engaged with others that much? You know, what is the culture of your organization? Because if you go back and take a look at this, not the Marlboro Man, this photo, if you have been out there, you might have stopped and talked to this guy. You might have stopped and talked to the guy on the horse. And his name's Joe. You know, that's not the Marlboro Man, that's Joe. And what Joe does is he's quite a smart guy. He put this sign up so that where he's posed, he knows that is a perfect photo, and he dresses for the perfect photo. And he knows that there's only one way in and one way out. You can see the edge of the road down here in the lower right. There's only one way to get in, one way to get out. So when you go down to the end and you take your photos and you come back and you've probably taken one of him, he just turns around and rides over to the road and says, howdy. So think about the culture that you create, because they do. Stories create your culture.
So to touch on how you combine these stories, how you combine these themes for your stories, we want to give you an example of the Hopi Education Endowment Fund, which is an organization that we've been affiliated off and on with for a very long time. And they are an organization based on the Hopi tribe, and they provide scholarships to any enrolled tribal member who chooses to pursue higher education. Whether that's an associate's degree, a bachelor's degree, a master's degree, PhD, they can provide financial assistance. And their job is to protect the permanent endowment that's been created to provide scholarships to Hopi enrolled tribal members. And they take all of these pieces. They communicate history, they communicate identity, they communicate memory, they communicate culture through the stories that they tell through the HEAF. And if you want to look up more about them, go to hopieeducationfund.org, and it's a really wonderful organization. So
in fact, it helped establish Alice and I working together.
That's true.
It was the first client that she asked me to help her do a workshop in which we were teaching them about psychological consumer profiling. You know, what do people think? If you know what somebody thinks, you know what motivates them, you can predict behavior, and if you can predict behavior, you can guide behavior. So yeah, first time that we worked together on this, I came from the dark side, salesman, used to work for television companies and all types of media research, made millions of dollars for the man. Told him I would never shovel coal into somebody's machine again, that I needed to do something that was going to matter to me, that was going to make a difference. And the day I worked with the HEAF, we're in the parking lot, and I turned to Alice and said, this is it. This is what I was meant to do. I'm meant to help people like this make their communities better, help them try to make those communities better. So it has a special place in our heart because of all four of these elements of storytelling.
So I'm not going to go into this for sake of time, but if you look them up again at hopieeducationfund.org, you can learn a little bit more about them. And I would give you as an exercise to look at it and see how they communicate history, how they communicate identity, memory, and culture through the stories that they tell throughout their website as well as on their social media.
There's a couple of great YouTube videos out there as well that we helped with. So, you know, check it out. You've seen enough cat videos.
Okay, so the next part we want to talk about are classic story structure and themes. So once you have this idea of those four things the stories can do, now how do you actually make those stories happen? So this is the easiest way to tell a story. And again, there's four things. First, introduce your hero, get him up a tree, throw rocks at him, and get him out of the tree. Okay, we're done. So this has been attributed to George M. Cohen or Robert McKee, who is a script writing instructor, depending on what resource you check. But this is really basic story structure. Again, it's 4 items, because essentially your stories have to have a protagonist or protagonists, an obstacle or obstacles, a journey to overcome the obstacle, and a resolution. So if you can get all of those 4 things into your story, then it will be a powerful story. And it also gives you a structure and a narrative to follow through, because we're trying to get someone to essentially walk along with you on that journey. So that's what you're trying to communicate with those that you're talking to. So when we look at the classic story themes, our third set of 4 things, these are the 4 universal themes that happen with classic storytelling. And so I'm going to hand it over to Jim to touch on these at least the first 2.
Okay. So the stories are broken up. If you think about it, we got 4 things again. So we're at 4 fours, because you have a negative collective, that is Mob at the Gates. You have a negative singular, that is our negative individual, that is Rod at the top. You have a positive collective, that's benevolent community, and you have a positive individual, and that's triumphant individual. So when you think about Mob at the Gates, you think about situations in which somebody's out there to take what you got, or they are trying to prevent you from getting what you deserve. And if you think about political advertising that you might see, they're always using Mob at the Gates in some way. It's rare that you see them spin to a positive. It always seems to be a negative. And they use Mob at the Gates in a lot of different ways. But frankly, these 4 stories, they are deeply established in Western culture storytelling. Every movie you ever watch will probably have all 4 of them in it. Every ad you watch will have 1 or more, depending upon what emotion that they're trying to trigger. But we've had mob at the gates with every armed conflict that we've ever had. We rally to fight off the foe. But we have mob at the gates that we're being told to fear now. So if you think about what would be something that we're told is a mob at the gates trying to take what we got or keep us from getting what we deserve, you might think of something like this if you've ever been near the border at San Diego. Because, yeah, we're told about a lot of things in the news every day. We are told about these groups that are the others that we need to be worried about. When you think about that story, you might say, I'm never going to use a mob at the gates. I'm never going to use a mob at the gates. But the truth is, they can be powerful, and they don't have to be directed at a group of individuals. It can be a story based on a group of conditions that you deal with, laws, regulations, things like that can be a part of this story. It's like, if we don't do this, or we have to do this because this hasn't been taken care of by somebody else, whatever that story might be, you probably have a mob at the gates of some sort. What is it that you are trying to stop? If you are trying to stop something in particular in some way, that is a mob at the gate story. So that's your negative collective. Your negative individual is right at the top. And this is a simple story. It is anybody who has great wealth and or power, generally those go together. If somebody who has great wealth or power that is abusing it, who takes it all for themselves and who doesn't care a lick about anybody else. They are simply that glutton that wants it all for them. It's like, how much do you need? So think about that. You may not have a specific right at the top story. And if you do, change their name when you tell their story, okay? Because you don't want to overly personalize this in most cases. Sometimes you do. Depends upon circumstance, depends upon the story you're telling, but a lot of times you might want to change that right at the top name.
The other thing that we have, back to the collective, is the collective positive story, which is benevolent community. And in historic times, you would think about the barn raising, because what you ended up doing was that you came together because one person couldn't do it alone. But if you all came together, you could get the frame up for that barn pretty quickly. So that's benevolent community collective in the past. And realistically, we used to use a picture of Habitat for Humanity. But if you attended AFPICon Virtual, you got to hear from Chef Jose Andres. And his organization, World Central Kitchen, I think is another example of benevolent community. Because even though he's the spokesperson for the organization, he's very clear that it's not just about him. It's about the collection of chefs. It's about the collection of volunteers. It's about all the people in the community who essentially come together in times of crisis to help one another. So most of the work that's done by World Central Kitchen is done through an incredible volunteer force. So that's benevolent community in terms of a collective of how do we come together for the betterment of all. And then your fourth story, which is the positive individual, is the triumphant individual. Now, this picture is a picture of the unsinkable Molly Brown, who survived the Titanic and was one of those people who was really poor when she was growing up. She brought herself up by her bootstraps. She became a millionaire and then ended up surviving the Titanic and was quite the celebrity during her day. So when you think about the triumphant individual, that's someone who succeeds in spite of all odds thrown against them. And it's not that they succeed on their own. They typically succeed with the help of a benevolent community, but they're the story that we can focus on for a lot of nonprofit causes as to here's what we can do in terms of impact. Here's the individual that we can help. And I had a different example. I had Bat Kid in here as an example, who, by the way, is cancer-free now, I found out. But then I realized another triumphant individual inspired me more. And I want Jim to talk about this young lady.
Oh my gosh. I don't know her. I don't know her. I spoke to her mom just to make sure that she knew what I was doing. I was taking photos for EAA, the Experimental Aircraft Association. They do an annual event. How many people come to the fly-in, Alice?
Over the course of the week, probably 250,000 people.
Yeah, it's an incredible event, the biggest air show in the country, and for that period of time, they are also the largest air traffic control center and manage all their planes by sight and instruments. They're out on the flight line talking to people on radios. But the most fun, I was supposed to take pictures that we could use in annual campaigns and for our mailings and solicitations and stewardship letters, cultivation, all that. And in this case, I found that I had the most fun when I was shooting at Kid Venture, which is where all the kids' activities are. And introduced myself to the parents, let them know what I was doing, and simply said, we're taking photos that we might use in our materials to help others support our events like this. And everybody was in, nobody said no. But when I shoot photos or when I'm looking for them online from my publications or something, I always look for emotions or ideas. I don't search nouns. So tell me what you see, even if there were no captions. What do you see in this series of photos that I took of this young lady? What do you see? Where did she start? Where does she finish? She finished very triumphant, very confident, and that's not where she started. And this was something that we used in our direct mail campaigns. So think about that when you're putting your social together as well, or your digital content. What emotions do you express? What ideas do you express? Not just the nouns that you're showing.
So what we would like to communicate is that when you combine these themes, just like benevolent community and triumphant individual, that's when you're going to have the most impact. And probably the best example of how to combine all of these themes is everyone's favorite holiday movie, It's a Wonderful Life.
Yeah, it's so awesome. I mean, you've got all four elements. Like I said, most movies have these, but they are really distinct here. You know, why did George have to stay home? Why did he have to stay home and take care of the bank? Because he had a college scholarship and was supposed to go play football. But those darn Nazis, so his brother Harry had to take off and he had to fulfill the role at home. And up in the top right, that's Potter. My God, Potter, you greedy fool. How much do you need all the money in town, you jerk? Down in the lower left, you've got the benevolent community. I will tell you that if you watch that scene, and when that little boy drops his coins into that basket or into that bowl, when he drops those coins, if you don't tear up, you've got no heart. But I'm a big softie. Every time I watch a Steven Spielberg movie, it's like, damn it, Steven, you got me again. And down in the lower right, yeah, George is our triumphant individual, but the whole family is. In fact, in this case, the town is filled with triumphant individuals.
So when you combine the stories, they can be really good. All right, so we're going to go to how do you tell your stories? And this is one of those things where we have the dreaded elevator speech, right? Nobody likes to do an elevator speech. It's like, oh gosh, I got all these things I got to touch on and I have to do it in a minute or less. Well, and we work a lot with rural organizations in Northern Arizona. So our friend Sam Tanakomva at one point, or maybe it was Vernon Cahey, I'm not sure, with the Hopi Education Endowment Fund said, you know, we don't have elevators out here. Could we just call it the walk to the truck speech? So we call it the walk to the truck speech in Northern Arizona because I think our tallest building only has 6 floors. So this is how do you communicate what you want to talk about in a very succinct fashion. And again, there are 4 parts to this. There are 4 elements to the walk to the truck speech. There's who you are, what you do, why it matters, and how you can be a part of it. Of those 4 things, what is the most important? It is, of course, why it matters. Because if they don't,
I'm sorry, if they don't know, or if they don't know why what you do matters, if they don't care about it, then they don't care who you are, they don't care what you do, and they sure aren't going to be a part of it. But if they do know why what you do matters, they'll learn who you are, they'll learn what you do, and if they have a connection, they will be a part of it.
So this is your opportunity to share stories in a succinct fashion, but what I want to caution you against is do not give people something to memorize. Because I encourage you to do this exercise with your team or with your board or with anyone who needs to communicate on behalf of your organization. Give them the challenge of, okay, you have 1 minute talk about our organization in your elevator pitch. Go. And they'll do their thing. The next round of the exercise, ask them to do this. I want you to talk about something that you have personally supported for 1 minute. And it can't be the organization that we just asked you to talk about. So something that's important to you, talk about it for a minute, go. And inevitably what you will see is that the second time people will have a much easier time talking about it, because it becomes much more personal when people don't think they have a script that they need to memorize. Encourage people to think about your organization that way. Talk about it in a way of, if I was personally supporting this organization, which hopefully you are, but think about it from the perspective of someone who supports your organization, and talk about your organization that way. Don't talk about it in a way that you have to, oh, I have to hit all of these points. So why it matters, as we just said, is the most important piece, because what you want to talk about are stories of impact. And probably my absolute favorite story of impact started as an exercise that I really didn't want to do, which was, I was a trainer for United Way of Northern Arizona. And we had a campaign meeting coming up for one of our worksite campaigns. And we needed someone to provide a testimonial as to why United Way was important. And a woman raised her hand in the committee meeting and said, I want to be that person to talk about it. And frankly, we were all a little bit taken aback, because she wasn't someone who normally liked to talk in front of large groups. In fact, usually she was a pretty shy person who was terrified of talking in large groups. And so the chair of the committee pulled me aside afterwards and said, are you available next week in case she chickens out? I'm like, oh, okay, fine. Yes, absolutely. The day before the presentation, she calls me and she says, yeah, can I practice with you? And I'm thinking, oh no, she's chickening out. Oh yeah, sure. Yeah, I'm absolutely, I can come over. Just give me about an hour. So I went over to her office. And we found a little cubicle, an empty cubicle, and we sat down. And I said, so tell me what you want to talk about. And she started talking about, well, you know, United Way is a nonprofit and they do this, that, and the other thing. I said, no. You were the first person to shoot your hand up to talk about why United Way was important. Why is United Way important to you? And she swallowed. I've never told this to anybody. Okay, well, tell me your story. Well, I'm a survivor of domestic violence. Oh. So I was in Phoenix, which this is a picture of, and I was in a bad relationship, and I, at some point, knew I needed to get out. And at one point, I decided this was it. I had to get out of here. And he was away at work, and I packed up everything I could fit into my car, and my dog, and my child, and I got as far as we could get on one tank of gas, which was Flagstaff, Arizona. And she got to Flagstaff, Arizona, and she didn't know anybody, and she didn't know what to do, and she didn't have any money, and she was desperate. And she said, I'm parked at the side of the road, and I don't know what to do next. When all of a sudden I remembered there was that presentation at work that one time, and United Way helps people. And she didn't know what they could do for her, and she didn't know whether they could provide her services. She just remembered United Way helps people. And so she managed to find the United Way office in Flagstaff, Arizona. And she walked into that office, and they immediately helped her. They got her a place to stay. They connected her with an organization to get her a protective order. They got her transitional housing. They got her food. They got her care for her child. They even got her connected with someone to provide healthcare for her dog. And she paused and she looked at me and she said, had I not found that office that day, I think I would be dead right now. And
it's 9 o'clock.
Then she paused and said, do you think that story would be okay? And I said, you tell that story exactly like you just told me. And this is going to be a really good campaign for this year. And they did end up raising the most they'd ever raised at that organization. And since then, because she was willing to be vulnerable, because she was willing to share a story of impact. And that's what's important about all of your stories, whether you tell them during a time of crisis or not, is sharing that story of impact, sharing the difference that you make as an institution on people, on real people. So I would encourage you to think about, as we share these stories, as we're in this time of crisis, how can you still share those stories of impact? And some of these things that we're going to wrap up with are things that I've stolen from Stephen Screen. So I would encourage you to look up Stephen Screen's video about communications during COVID-19, because he did this one video that's really, really good about how do you put together communication related to coronavirus. But some of the main points are: keep it simple. People don't want to read through complicated, long things. Keep it simple and short. Make sure you lead with the facts. Do not lead with an ask. Lead with, here are the things that we are doing to deal with this crisis. Always share a story of impact. Don't forget that, again, if your mission was important before coronavirus, your mission is important now. How are you still making an impact on people during this time of crisis? Be honest and empathetic. Make sure that you show that you're human, and don't be afraid to ask them to be a part of the story. Don't be afraid to ask. That's kind of my bottom line thing. So the stories that you tell right now, particularly in a time of crisis, will shape how people perceive you well into the future. So think carefully about the stories that you're telling now, but continue to share your stories, because your best communications may come out now during this crucible of coronavirus. Because your communications, the best ones you can send out right now, are going to be ones that are authentic and transparent. So how can you connect with your audience and make sure that they know that you're human and that you're in this with them? So in summary, just to wrap up all of our 4s, actually there's 5 on this slide. I guess I'll have to edit it for future purposes. So the 5 things in summary are: yes, you should be communicating now. Your stories help tell your history, identity, and culture in a memorable way. Your story should have a hero, an obstacle, a journey, and a resolution. You have your 4 universal themes, and they're more powerful when combined. And tell people who you are, what you do, why it matters, and how you can help, but why is the most important.
Yeah, Alice, I would toss in that as you're going through the process and you're thinking about your own story, 2 important things to do when you share those stories of impact. If there is a reason or a way that you paint yourself into that picture, it will be especially meaningful to show how you are a part of this and how this is meaningful to you. And if you can't, you can tell other people's stories of impact. And if you don't have a really solid one person, then create an aggregate. Tell elements of stories of a variety of people. And the last thing, just another word of caution: if, as you're preparing for your elevator speech, or you're preparing to tell your story, if you have the words or the sentence in it, "We are a 501c3, excise it. Excise it, because there's fewer and fewer people who care about that until they've already made a decision if they're going to support you or not. You've got to get them interested first. And a lot of people don't even understand why you would tell them that. So get that out of your language, out of your jargon.
So with that, this is our contact information. If you do have any follow-up questions or would just like to have a conversation at some point because you're tired of talking to the people that you're already talking to during shelter in place, we're happy to have those conversations with you. You can reach out to either one of us at our emails, or I've listed a bunch of our social media and online presence. So that's all we have for today. Thank you very much for participating. And with that, I'll turn it back over to Rebecca.
Thank you.
Thank you so much, Alice and Jim. That was really great. I don't know if everyone knows this, but when everything went down with COVID, we were worried we were going to have to cancel all of our events, but you all offered to still do this webinar, and the information that you shared with us today is just so relevant to what we're all going through. So thank you. Really appreciate you all taking the time. We didn't get any questions in the chat, but if you do have questions, please send those to admin@afphouston.org, and we'll be sure to pass those along to Alice and Jim. Again, that's admin, ADMIN, @afphouston.org. I want to also thank our program chair, Brina Bowman-Gonzalez, for making this happen and coordinating everything. And also want to thank all of you for joining us today. We had more than 80 people the entire time, so that was some great attendance. We'll be offering a recorded version of this session to all members early next week. And as a reminder, you can get CFRE credit for this session as well. Also on Monday, you should receive a survey about today's session. And as we work to try to establish some more virtual options for our membership, we would love to hear your feedback, along with any topics that you might be interested in hearing about. Thanks again, and happy fundraising.